Lisa is the director of a small Native American health clinic. Other than her and a part-time physician, the only professional staff members are 2 RNs. The remaining staff members are Native Americans who have been trained by Lisa. Because Nurse Bennett, a 26-year-old female BSN graduate, has had several years of experience working at a large southwestern community health agency, she is familiar with many of the patient's problems. She is hardworking and extremely knowledgeable. Occasionally, her assertiveness is mistaken for bossiness among the Native American workers. However, everyone respects her judgment. The other RN, Nurse Mikiyu, is a 34-year-old male Native American. He started as a medic in the Persian Gulf War and attended several career ladder external degree programs until he was able to make the RN examination. He does not have a baccalaureate degree. His nursing knowledge is occasionally limited, and he tends to be very casual in performing his duties. However, he is competent and has never shown unsafe judgment. His humor and good nature often reduce tension in the clinic. The Native American population is very proud of him, and he has a special relationship with them. However, he is not particularly good role model because his health habits leave much to be desired, and he is frequently absent from work.
Hey B, what's up?
Hey, you're late.
Yeah, I guess time just got away from me.
Really? Where were you yesterday because you weren't at work?
I was sick.
With what?
The flu.
And you're all better today, huh?
I just have this wonderful immune system.
Really?
Yep.
Well, let me tell you, you're behind. You're late. You have 2 patients waiting for you in room 1 and 2. You smell like cigarettes. You're eating. Like, we need to have you get started, please.
All right.
Thank
Cool.
you. Wow, really?
I don't want to smell like smoke.
Okay. It's okay. Hey, Terry. Oh, I thought I told you to take vital signs in room 5 and 6. I don't see them recorded at all.
I was just on my way to do that.
Really? Well, that would be great as soon as possible because, as you know, Nurse McHugh is late again, and we're running behind on time. And so, I don't want you standing around. I need you to, take care of business. Okay? All right. Thank you.
How's your diet? I like barbecue, and I eat Mexican food. I eat about everything. Yeah.
You know you have high blood pressure, right?
Yeah, but, gotta eat what I gotta eat, right? I mean,
Yeah.
what can I do?
Yeah, but we need to work on your diet a little bit. It's important for you to be able to eat a healthier diet, and that'll be good for you. So we can go over that with a list of things that you can try to avoid. Okay?
Okay,
All right. Okay, I'll be back.
Nurse Mikiyu has finished with 2 patients. He is 4 patients behind. Nurse Bennett has finished with 6 patients.
Steph's blood sugar was 180.
Yeah?
So what do you think I should do?
Did you give her insulin yet?
No, I didn't. I wanted to know what you thought.
I think she's on a sliding scale. Have you looked at her chart at all?
I just haven't had time to look at anybody's chart yet.
Of course you wouldn't have time. You were half an hour late. Here's her chart. Here's a sliding scale. Right there.
Oh, yeah. 2 units.
Yep, you might want to go do that now.
All right, I'll go in my room.
Are you forgetting something?
Oh, yeah. Thanks.
1 hour later.
Hey, Nurse B, I'm going on a smoke break. I'll be back in 20.
Right now, you're going to go on a smoke break? You know you're late, right? You're late on all your patients.
Cool, I'll catch up by the end of the day.
You're smoking as a nurse?
Yeah.
Really?
Lisa, can I talk to you a second? Sure, have a seat.
Thanks. I need to discuss Nurse McHugh with you. I am very frustrated. He doesn't show up to work. He's lazy. He doesn't do his job. He runs behind all day. I end up doing way more work, way extra work. I stay here late. I'm starting to resent him, resent my job. I am really unhappy here. This is not working out for me. I feel like you either keep him or you keep me. He shows up with junk food all day and smoking, and I just don't think that that's where I want to work. So I feel like this is a decision for you. You either keep me or you keep him.
Okay, well, I'll see what I can do.
Solution number
thank you.
1, forcing, a method that yields an immediate end to the conflict, but leaves the cause of the conflict unresolved.
Alright, well, I see where you're coming from, and you're right. I'll ask to see Miku by the end of the day, and I'll tell him that he has been let go.
Thank you so much. I'm really glad that you're seeing things my way. Thank
Solution
you.
number 2, collaboration, implies mutual attention to the problem in which the talents of all parties are used. The focus is on solving the problem, not defeating the opponent.
Okay, Nurse Manette, I understand your concern. I am also concerned about his behaviors and him coming in late all the time, but he is very well respected by our patient and he knows what he's doing. I will try to talk to him, and in the meantime, I'll just schedule you guys apart and make sure that you guys are scheduled together.
Solution number
thank
3, confrontation, most effective means of resolving conflicts. This is a problem-oriented technique in which the conflict is brought out into the open and attempts are made to resolve it through knowledge and reason.
Okay, Nurse Manette, I value the work you do, and I understand your frustration, but I do want you on the team with me. Have you talked to Nurse Miku about this yet?
No, of course not. That's why I came to you first. I wanted you to know before I did anything.
Okay, well, before we make any rash decisions, I want you and Nurse Miku to sit aside and I'll set up a meeting. You and Miku will make a list of pros and cons and we'll talk things out first. Is that okay?
Okay, I can do that.
Okay.
Sure. Thank you.
Okay, well, I asked both of you guys here today to resolve some conflicts, and I also asked that both of you guys make a list of pros and cons. Nurse Bennett, will you please read your first?
So the pros for Nurse Mikyu are that he's competent and he shows safe judgment. He's got good humor. I put good nature. You reduce tension in the clinic. You're well respected by the Native Americans. They're really proud of you. You have a special relationship with the people, which is good. Your cons are that you're really lackadaisical and casual when it comes to your duties. You have bad health habits that shows, a poor role model for the people, and you're frequently absent from work, so that makes it difficult. Your knowledge is limited, and you're seen as unprofessional in my eyes because of those reasons. So.
Okay, thank you, Nurse Bennett. Nurse Miku, would you read yours, please?
So the pros of Nurse Bennett are that she has several years of experience, is hardworking, extremely knowledgeable. Everyone respects her judgment. Her cons are that, your assertiveness can seem kind of bossy to me and to the other workers.
Okay, thank you, Nurse Miku.
Nurse Bennett, I sure am sorry about being late and absent so many times. I never knew how much extra work that made for you. And, I've been really trying to quit smoking, and I just don't have enough time in the morning to make a healthy breakfast and have a healthy lunch. So, I guess I just need to start waking up earlier. And I really do respect your judgment. That's why I ask you so many questions, and I really do learn a lot from you.
Thank you, Nurse Miku. I didn't know that you were trying to quit smoking and stuff. I wish you would have told me, because I could have helped you with some smoke cessation programs. And I know it's really hard with the whole healthy eating thing, and sometimes I sneak in a unhealthy snack here and there, but I just try not to do it in front of the patients, and I really didn't realize that I was being so bossy. So I'm going to really try in the future to be more assertive without being bossy. And hopefully that will help us, have better communication in that sense. If that's okay.
Yeah.
Great. Okay.
Okay, good.